Good afternoon. First of all, I would like to express our gratitude from the Andalusian Health Library staff for allowing us to present our repository in the Medical Institutional Repositories and Libraries Symposium. From my side, also on behalf of my colleagues from the Andalusian Digital Library of Health, who are accompanying me this afternoon from Sevilla. We are the managers of the Institutional Health Repository of Andalusia. This is a digital library for all the health system of Andalusia. The health system of Andalusia is a public system. Andalusia is situated in the south of Europe, in Spain. It is composed of 8 provinces and it is the biggest autonomous community of the 17 Spain is divided into in terms of population, with more than 8 million inhabitants. The Andalusian health public system has approximately 120,000 professionals who work for the 63 hospitals, 1,500 primary care centers, 5 research institutes, 2 specialized centers, 2 laboratories, and several centers for training, managing, as well as forensic services. This is the map of the Health Ministry of Andalusia. The Andalusian Health Library of the public system was set up in 2006, and it was previously established in the second quality plan of Andalusia, where it defined as the strategic action for the scientific information in the health system. The main milestone of the library was the centralized subscription for all the hospital, research, management, and training centers, and also the creation of different services as the bibliometric analysis of the scientific output and of course the rubric. The digital library was set up in 2006. These were the main goals of this library. Italy has established as the facilitator of the knowledge management in the Andalusian public health system. We define it as the driving force of this health system in terms of knowledge management. The main goal was to provide health professionals with the means to identify, locate, and obtain the documentary resources needed to carry out their activities. But also, we were very concerned about helping citizens to find unbiased and understanding information to enable them to actively participate in decisions that affect their health. The Institutional Repository of Health of Andalusia was created in 2013. The Spanish Law of Science, Technology and Innovation established in 2011 that scientific output derivative from research financed with public funds had to be openly available in a repository at least after 12 months of embargo, always preserving the terms of the agreements authors could have signed with publishers. This was also established in the Horizon 2020 program for the European Community. That is, in 2009, our second plan of quality, the following plan of quality established, in fact, the setting up of the Andalusian Health Repository. In 2013, we launched our repository. I must say that it was the first one in Spain to be indexed in link out of PubMed, and it was the 4th in the world. The institutional repository is based on in software DSpace 6.3 with the Dublin core metadata. It collects all the scientific production generated by professionals of the Andalusian public health system as a result of their assistance, research, management activity. It was divided into 6 communities. As you can see, we only deposited documents through delegate deposit. The librarians of every centers of the hospital network and research centers deposited the documents of their respective centers. In 2022, we launched a tender to deploy several improvements of RISalud, the institutional repository of health of Andalusia. We wanted to deposit research data to integrate persistent identifiers as ORCID for authors, Scopus ID, and DOI for data. And we wanted to have more items in our repository, so we made a bulk upload of more than 16,000 documents. We also are interested in being collected by Recolecta, the national collector, and OpenAir. We integrated two MES and DEX, Thesaurus, and the control vocabulary. Now our repository is divided into 3 communities, and the first step was to make this bulk upload in order to gather all the opened publications of our centers. We also have another community for authors, because the DSpace 7.6 works more or less like DSpace CRIS. In fact, we identified the scientific production in open access from 2016 to 2022, almost 17,000 documents which were uploaded in our repository. And this is the repository is a brand new repository which we present here. We are still implementing some functionalities. It's not 100% working, but it is accessible online. As I said before, it has been divided into 3 big communities: for assistance, research, and for the institutional information. It is also being collected by Google Scholar, OpenAir, Recolecta, and Hispana. It integrates the last version of the core vocabulary, and you can find the documents by authors, by the title, by MES, by CIE, for the documents, for the type, the kind of documents. The main milestone for us is the possibility of depositing data sets, because we also work for applying the data set with the digital object identifier, and for us this is very, very important. The the law for science, technology, and innovation was modified last September. It established that all research output of that which has been financed with public funds has to be in open access through thematic or institutional open access repositories, simultaneously with the date of publication, that is, with no embargo. And here is the importance to institutions to have their own repository. The Horizon Europe, the next program for the European Community, states the same thing. we have implemented the appropriate changes to be able to deposit the accepted manuscript. So these are the different versions that our authors can deposit in our repository. And one of the versions is the accepted manuscript. We have still challenges in front of us in order to be faced for next year. The upload of 2023 scientific open access production, the drafting of depositing procedures, the integration with EOS, European Open Science Cloud, the training for the librarians as well as for the researchers for depositing their manuscript, developing the statistical module, and one thing is important is the agreements with publishers for the accepted for allowing us to deposit the accepted manuscript. We also started a line a work in the Andalusian Digital Library to negotiate transformative agreements for the version of records with publishers. Thank you very much for your attention, and as I said before, thank you very much for giving us the opportunity to present the Andalusian Health Repository to this important symposium. Thanks.
And up next, the last group for the session is Pamela Pierce and Mary Jean White from Oregon Health and Science University.
And it is just me. I'm Pam. I'm the Digital Scholarship and Repository Librarian. And I really wanted to acknowledge Mary Jane, who is at DLF right now, and our full digital collections working group as well. But Mary Jane's expertise, as Robin mentioned earlier in this morning's panel, really helped with doing the evaluation of platforms and doing some of the cleanup work that I'm going to talk about, creating authority records. I mean, she is instrumental in the work that we do. And what you're looking at right now is our homepage. And this is our new digital collection platform. And we migrated into TINT, both the IR and archive part of it this past summer. So it's just a few months old. We had a survey to select the image that would go on this page with a few of the archival images that are included in our collections, and we let students vote on it, which was a great way to get involvement as well from students and to let people know about the platform. So that was an early stage of marketing that we did. And we have about 10,000 items total, both from the IR and the archive in our platform right now. And we keep adding items, and adding them has gotten really easy in this new platform. That was something Jesse, our digital collections coordinator, and I were talking about just yesterday. We have it set up so when a thesis or dissertation or any item is added, it also appears in our library catalog at the same time within Primo. And it's beautiful. It's also a hosted solution, which fits the needs that we have at our library. We like being able to create support tickets when we have an issue, and then we have them efficiently addressed. We also spent a lot of time in the implementation process working on our submission form, thinking through what needs we had in terms of departments and programs, and making sure that we tried to anticipate things in the best way we could, while also recognizing that it's not possible to anticipate everything. We have had people using the self-submit option within our platform, and they actually think that it's genuinely intuitive, which is always an amazing thing, because people talk about something being intuitive and it's often not. We get some minor questions, but people are not actually experiencing a lot of pain with that. So it's great to be at this stage of gently tweaking things. We also have improved metrics within our items. So when you're searching for items, you can easily see views and downloads. And it's, of course, the end of the year, and we have some stats to submit, and we're able to pull reports on that. And people can narrow search results by categories easily, like topic, name, and date, and have everything fully function. And create customized search lists and alerts for new editions. And all of the items are set up with MARC fields. And I have no expertise in MARC, but for some of the basic editing things I need to do, it's easy to look at example records or Google like what a MARC field number means, and then it's possible to really just kind of figure things out. And we work really collaboratively in doing that as well. And this is at least one part of our submission form. And you can see that we're interested, I should say, at least I'm interested in the geographical subject and how that can be used. And previously, for submitting theses and dissertations, we actually had people download a PDF, which I say that out loud and it sounds painful, and it was painful and cumbersome. But as I said, things are working a lot better with that process now. And when we moved from Samvera into TIND, we had a lot of metadata to clean up. And Marijane, who is here in spirit with me, she taught us all to use OpenRefine. That was a few workshops she did for library staff, and anyone was welcome to attend. And there were tasks across the library that could use OpenRefine, but the digital collections team really focused on using that to clean up the department and program related information. And that's something that I know Jesse and Steve Duckworth, who's done a lot of work in cleaning up our historical records, has also used that. And we also can add things, sometimes simple things, like just a collection field. Having something nicely sorted into a collection makes it more findable. And we've also tried to prioritize cleanup that will help students be able to easily browse example projects. One of the collections we created was a collection of DMP work, which the nursing people were really excited to have that all in one place. And that has provided them the ability to contextualize the work that they're doing and to think through projects right when they're in their earliest stages. And in the marketing, we worked with our communications person within the library to really create a blog post that fully represented TIND and to make sure that was shared in the appropriate channels where it would actually be seen and read, because a lot of times we write blog posts and they don't actually get read. And I know that there's questions coming into the chat, and I'll try and go back to those too. I can see a few of them popping up. And really working on the relationships already in development as well. There are people who had been waiting for us to migrate into this new platform and trying to follow up on those, making sure that you keep clean records and remember those things, because sometimes it takes a really long time to be able to go back to them. So the follow through is something that I happen to be really good at. And one of our long-term goals is having students be able to browse by mentors. We have real role capabilities in this new platform. So eventually the goal would be the students might be able to select a mentor based on the previous work they've done. And it also, a selling point is that it genuinely works as a tool to show research contributions and all the different roles inherent in that. And that's something that I'm really excited about as I go out and talk to people about this. A lot of love for OpenRefine in the messages that I'm seeing pop up. That would make Marijane really happy. And should I try to answer questions now, or do we want to hold that to the end?
We're gonna do like a bulk group.
Okay, sounds good.
So if you're done.
I'm done. Thank you.
Great, awesome. Okay, so Anthony, did we have any questions pop up in chat?
Yeah, there's been a little bit of conversation through chat. Some of them have been answered. There were for a few from the previous presentation, and I believe that they've already been answered by Heather and by Amanda, but let me draw your attention to them because I know people are paying attention to the current presentations. Questions that came about during that section were there concerns over which authors would have been included or not included as an expert in the authors database, and Heather said yes, that is definitely something that folks had feelings about, was whether they were included initially, but we had left ourselves a lot of room to grow and were able to add them ASAP if they met the threshold, and that smoothed things over. And we encourage folks to spread the word and let us know if we've missed people. So I guess also an outreach tool. We haven't heard about anybody upset about the threshold. I think later Amanda added to that that the threshold was a bit of a motivator in some departments to get research, authorship, conference involvement to be able to qualify for addition to the platform. The nursing department, for example, was motivated to get nurses involved in conferences and journals. In turn, they can also have a goal of getting an expert profile as they grow their CV. I don't know if Heather or Amanda want to elaborate on that at all, in responses to that.
Well, I did see Stephen just asked a limit on seats to play musical chairs. So yes, that was a question when we were doing contracting, that, you know, once somebody leaves, does that seat, you know, open up, or do we have to buy another one? And so it does so open up once they leave and remove it. So when they leave the organization, we remove them, and then we'd have space for somebody else. That is a little bit tricky, since we don't have a great way for all of our users to be aware when they've left the organization. Amanda mentioned that while Pure does allow the integration with your HR, you know, Active Directory, that wasn't something we were able to take advantage of due to some technology limitations. And so we have a bit of an internal workflow. If somebody is in our Active Directory, we'll know if they leave, but we do have some affiliated folks who aren't in the Active Directory due to their employment relationship. And so those, it is a little bit of, you know, we have to find out. And so there is possibility of them not being removed as quickly as if you do have it integrated.
Behind Heather on that. One nice thing about Pure is you can pull people just to the back end, and they don't take up a seat on the live site. So if we have someone that left for a couple of years and came back, we would still have that initial profile versus deleting it and then having to recreate the wheel and reintegrate everything. It's kind of a nice admin side feature.
And I'll just say, we're happy to take it offline if anybody wants to get some more, you know, down and dirty details about it as well. Feel free to reach out to us.
That's great. Thank you both. There was also a follow-up question which you also responded to, but I'll read the question and then you can let me know if you want to elaborate on it all. And this was from Ramoni. How about overlap and crossover for clinicians who have academic appointments? Did that create any challenges? And Heather, you'd answered, we have a policy of including anyone who's affiliated with Providence. If they have an external academic appointment, we can include the information in a free text field in their profile.
Yeah, the one thing I wasn't sure if this question was getting at as well is within our institutional repository, you know, we're not searching, you know, PubMed by name. We're searching by author affiliation. So it's definitely possible if we had somebody affiliated with Providence, but who for that particular article published under their, let's say, University of Washington affiliation, we may not capture that in our Digital Commons institutional repository, and we kind of rely on that author letting us know. But with Pure, because it's connected to their Scopus ID and ORCID ID, that information should be captured even if it's published under an affiliation for some other organization.
We do have plans to sort of audit what is imported via Scopus that might not align with our algorithms. So if we do miss one of those publications, we could still get it into Digital Commons.
Thank you for the additional clarification there. We had a couple questions that came in for Pamela. As you saw, I think you were watching it as you were speaking as well. The first question had to do with whether people opt out from sharing in Primo, whether that's possible, whether they choose to do that, whether you allow them to opt out sharing their materials.
They can definitely, I mean, they can embargo their work when they're submitting to digital collections. We haven't offered them the option of opting out over including things in the catalog. That's something that we really just recently started doing. So that may be something that we have more conversations around, but that's something that we can think through more. We definitely offer a lot of opt-out options for even including the work in digital collections at all.
Great. And there were quite a few questions and comments about your use of open refine.
Yeah, and I saw that Steve. Yes, and thank you, Steve. Steve is our archivist, and I saw that he responded and gave an overview, which is really helpful. And the department's dates, subject terms, and names, I think that's a nice summary of how we've been using it. We had a lot of messy departments, especially. There was a medical and informatics, DMICE is the acronym for it here. It's been through so many different names. There were so many permutations of that in our data. So that was one really specific use case. And then Steve gave the higher level overview of how we've been using it. But it's really helped us create more authoritative records and stabilize things that were really chaotic in our other system.
Great, thank you, and thank you to Steve for providing those responses as well in the chat. I'm going to jump over to Laura real quick. A question came in about the EU standards. How do you collaborate with or link to other regional digital libraries, if there are any in Spain, or are you more standalone? Oh, you are muted, I believe.
Mute yourself, Laura.
Okay, now thank you. We collaborate with other libraries in terms of digital libraries. There are other digital libraries for communities, and we have created the network of digital libraries in Spain, RISalud. But in terms of repositories, there are only 6 health repositories which have been set up in Spain, but we have started a project with the repository of the a Central Institute of Health, a National Central Institute of Health, in order to collaborate among us, among the repository of the communities and this repository of the National Health Service. But besides that, what the European community has is a collector, OpenAir, and OpenAir validates the metadata of every repository in order to collect their data and their metadata. For us, it's compulsory to be in OpenAir because we have projects which have been founded with the public investment, public money. So OpenAir is the big collector for Europe. And once you have a DSpace and you have a Dublin core, it's very easy to be collected by OpenAir and by Recollector, which is the national collector in Spain.
Great, thank you. Thank you.